Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. We also have Dr. Brendan Carr, who's the President and CEO of the Nova Scotia Health Authority, joining us today via Zoom. Go ahead, Premier.
Thank you, Chrissy. And as usual, I have Dr. Strang with me today, and I've asked Brendan Carr, the CEO of the Nova Scotia Health Authority, to join us today. Hi, Brendan. Now, before we turn it over to Brendan, let me give you a sense of where our current case numbers are. We are reporting 91 cases today, the majority, again, in the HRM area, but we're also seeing a concerning rise in cases in the Cape Breton Regional Municipality. There are 17 cases in Sydney and surrounding areas reported today. We have increased our testing capacity over the last number of days to try to catch and contain this virus, and I want to thank those who are getting tested, and I encourage others to do that as well, especially those who have been into areas that have an exposure site. The fluctuation in case numbers in Sydney is an indication that the variants are very much on the move in different parts of our provinces, and the importance to follow our restrictions and protocols that are in place. Currently, we have 95 cases in the hospital with close to 24 in the ICU. Now I'm going to turn it over to Brendan to go over an update.
Thank you, Premier. Good afternoon, ladies and gentlemen. So over the past several weeks, the Nova Scotia Health teams have really been mobilizing to respond to what has been a rising number of COVID-19 cases in the province. We've seen significant increases in the number of patients admitted to our hospitals, with high numbers of patients in our intensive care units. As of this morning, there are about 95 patients with COVID-19 in our hospitals right now, 29 of those in intensive or intermediate care, with the breakdown being 22 of those in the central zone, 3 in northern zone, 3 in western zone, and 1 in eastern zone. Our current protocols would allow us to surge up to 245 active inpatient cases for COVID. And in order to accomplish that, we've initiated a province-wide response, which means that staff and other resources are being redirected and redeployed to areas of greatest need. So this includes public health, our lab, our testing and vaccine clinics, as well as our inpatient units and intensive care units. So unfortunately, what this means is that some patients may be transferred to another facility if they're admitted to hospital, and that some surgeries, tests, and procedures will be postponed. This is necessary to ensure that we have the capacity and the specialized staff available to provide safe and appropriate care for all those who need it. So we know that this will have an impact on our patients and their families, and for that we are very sorry. However, it is necessary to ensure that we have the resources where we need them, when we need them, to look after what is a rising burden with COVID-19. I also want to provide just a brief update on the outbreak in one of our hospital units. As of this morning, we have 12 patients and 4 staff members that have tested positive in connection with that outbreak. 10 of those patients remain in our COVID unit. There's ongoing surveillance and testing of the remaining patients on that unit, and enhanced precautions are in place to help prevent any further spread. We don't yet know the source of the infection, but given the high prevalence of COVID-19 in many areas of the province, the likelihood of COVID-19 infections among admitted patients is higher now than it's ever been. All of our patients are tested on admission to hospital at least once, and that admission testing may fail to detect COVID-19 infection in patients who have been exposed but not yet symptomatic. We will be retesting all patients at the Halifax Infirmary and the Victoria General Site at the QE2 Health Sciences Centre just over the next couple of days. The next few weeks will be challenging, as we expect the number of people admitted to hospital for COVID-19 will continue to rise. And in the short term, even though in the short term our overall case numbers might be going down, we are anticipating our hospitalizations to be increasing for the next week or so. But our health system has the capacity and the specialized staff to meet the inpatient and critical care demands for COVID-19. If there's one thing that I am absolutely certain of, our teams will continue to respond in the committed way that they have done so, and they will continue to work very hard to make sure that we're here to look after the citizens of Nova Scotia. Thank you.
Thank you, Brendan. Appreciate all the work that you and your team are doing to keep all of us safe. And to your point, that's why restrictions and protocols are that much more important, because as we know, we think we may have hit our peak, and we're starting to see good signs of cases being reported that are under where we were at our peak, but there is a tail on this that we all know, that our modeling shows that the increase of hospitalizations come after that peak, a week to 2 weeks after that period of time. So that's reinforces that message. Just a little bit on the border, myself and I know some of my colleagues have received emails from concerned, especially rotational workers coming back home to their families. And as we announced earlier, there are some new measures in place to protect our border. And that applies to everyone that comes into Nova Scotia that needs to show documentation. So if you are a resident of Nova Scotia and working out of province, the application is to help you get in easier. And our rotational workers, for example, have been asked to fill out these forms so that they can show the status of their employment to come in. So to be clear, we are not saying no to any rotational worker. We just want you to have the right documentation, which could be a letter from your employer to prove that you're working out of province. All the same testing protocols are in place for you in the isolation periods, but we do need to have that documentation. Some of you are on that modified isolation, and then the change we made for hotspots within the country was a full 14-day quarantine away from your family, so that we could better protect those around you, and that's just the specific areas deemed hotspots. There are some areas of the country that have increasing cases, and we needed to take that extra step. I do want to thank all of you. I know this is tough work, and it's tough enough you're away from your families, so we don't want to impede your access to getting back home. So I know Dr. Strang may have more to say, and he continues to look at this so that we can ensure a streamlined process for all of you. On the vaccine front, I want to continue to encourage people to book their vaccine. We are obviously ramping up. We just dropped the age at the end of last week to 35 and up, and today is ages 30 and up. I hope to see more and more people booking their vaccines. I know the appointments are going quickly. We're expecting to do 72,000 appointments of vaccines this week, which is tremendous, thanks to our teams. And we're hoping to open up all eligible age groups by next week. So we're really moving fast to get through all those eligible to get their vaccine by mid-June. We're well on track, and I expect that we'll remain on track. So that's just a bit of an update from me. And of course, Dr. Strang will have more to say, and then all of us can take questions after that. Dr. Strang.
Thank you, Premier. Thank you, Dr. Carr, and good afternoon, everybody. We are back in the double digits today, and I hope this trend continues. We are seeing progress with cases, contacts, and spread, but we're not yet seeing the steady decline we had hoped for, and this is going to take some more time. If we want to have a summer with fewer restrictions, we need to stick with our current measures and do the hard work now. We do continue to see activity in all health zones. On Friday, I talked about communities with clusters of cases, the Sydney area, the Bridgewater area, and the Annapolis Valley from New Minas to Kentville. Excuse me, there are pop-up sites in Kingston and New Minas this week, and plenty of room at local primary assessment centers as well. So if you live in these communities, we need you to get tested. Please go to a pop-up or book an asymptomatic test at a primary assessment center at nshealth.ca/coronavirus testing. Our greatest concern is in the Sydney area, where we're seeing some concerning trends. But I'm also hearing today that we have lots of capacity, and we have less than optimal uptake of testing in that Sydney area. So especially if you live in the Sydney area, we need you to go out and get tested, whether you have symptoms or not, and we have lots of capacity for you. We are seeing a decrease across the province in people with no symptoms who are coming forward to get tested. And I know that we told you a couple of weeks ago that we had a backlog, and that people with no symptoms needed to go to a pop-up rather than a primary assessment center for an asymptomatic test. But that backlog has been dealt with, and we're ready to test as much as we can through both approaches. So we need everyone to get tested regularly, especially if you have a lot of contact with other people through your work, if you're the person in your household who does groceries and other essential shopping, or if you have to go out and about more frequently. So if you're in one of these categories, especially, even if you don't have symptoms, we need you to get tested regularly. You can go to a pop-up, or you can go and book an asymptomatic test at one of our primary assessment centers across the province. And if you have symptoms, even if they are mild, maybe you think it's seasonal allergies, you may well have COVID. And you absolutely need to book a test immediately at a primary assessment centers. And if you have symptoms, please do not go to work. Do not go out and about. Go safely and get a test, and stay isolated until you get your test result back. Today marks the beginning of a big week on the vaccine front, as the Premier said, with 72,000 appointments booked. We've opened to Nova Scotians aged 30 and older today, and as the Premier said, we hope to open to all remaining age groups by next week. That means all Nova Scotians who are eligible to get vaccinated will be able to book an appointment for their first dose before the end of May, and for vaccination in June. And once everyone has a first dose, we greatly reduce the opportunities for the virus to spread widely and for it to severely impact Nova Scotians' health and our healthcare system. Focusing on first doses and sticking with public health guidelines through the spring means that we can enter summer with fewer restrictions. It means getting back to a lot of things we cannot do now. As of today, 40% of Nova Scotians have had one or more doses of vaccine, but 75% is our magic number. To hit our target of having 75% of the entire population vaccinated, we need 85% of eligible Nova Scotians to get their vaccine. Right now, Nova Scotians over 65 are leading the way. Over 90% of them have been vaccinated with at least a first dose. And the next two age groups, 60 plus and 55 plus, are not far behind. So thank you to everybody in those age groups. But it's absolutely critical that younger Nova Scotians continue this high level of vaccine uptake. If we've learned anything from this third wave, it's that younger people are affected by these variants in serious ways. And even if you're not worried about your own health, think of your parents and grandparents. Think of those who cannot get vaccinated, your niece or nephew who are too young, or your neighbor who may have a medical condition that doesn't allow them to be vaccinated. Getting vaccinated protects everyone around you. And think about all the things that you love to do and want to get back to. Socializing with friends, going to the gym, concerts, traveling. The first dose is only one step, however. Everyone will need to get a second dose to be fully protected. And as I've said Friday, we're now looking at whether we can deliver second doses faster than originally planned. We're doing the detailed planning, and provided our vaccine supply is steady and stable, we should be able to meet that and start doing first doses for some people in late June and into early July. When 75% of our entire population is fully vaccinated with 2 doses, we will be able to significantly relax some of the public health measures we've had in place for more than a year. But without this population protection from the vaccine, restrictions will remain the only tool we have to control the spread of COVID-19. The virus needs a large number of unvaccinated people to spread. So we cannot give it that opportunity. Anyone who's eligible must do their part and get vaccinated. And in closing, I'd like to say, we have talked a lot about May will be a tough month. And so far it has been, and there are likely more difficult days ahead. But if we focus on our first dose and more restricted spring, we can have a better summer, and where we will all be able to then get our second dose of vaccine through the summer, and then ultimately get back to doing many of the things that we've had to give up. For now, follow the public health protocols, stay close to home, get tested, stay home if you're sick, and shop only for essentials. Get your first dose of vaccine, and when you do, encourage your family and friends to join you and do their part to protect themselves and those around them. Chrissy.
We'll now take one question and one follow-up in the time that we have for today. We'll start with CBC's Blair Rhodes.
Thank you. My question is for the Premier. You said that you weren't trying to restrict or prevent rotational workers from coming into the province, but we've been hearing from them, a lot of them over the last couple of days, that the new requirements, particularly the letter from the employer, that the messaging hasn't been that clear and that there's a great deal of confusion and concern about access to the province now because of these new restrictions.
So we are aware of the issue. What I said was they should not be denied access into the province. We know that it's a challenge to get that letter, so we're continuing discussions, and Dr. Strang is going to be talking to representatives to figure out if we may be able to have just one letter so they don't need to provide it every time. But we're working through that. It's to protect them because we have strong border measures. So we don't want them denied access. We've had, unfortunately, instances where people tried to get into the province dishonestly, and we need to make sure that we're protecting them by having proof. They should be able to get a letter just from their employer stating their status, and they had to do the safe check-in before, so that's what we're asking for them to do.
Go ahead with your follow-up, Blair.
I'm not sure who to pose this question to, but can somebody perhaps provide more detail as to what services are going to have to be curtailed or postponed in hospitals in order to increase capacity?
Brendan, maybe? You want to take that one?
Yeah. Sure, be happy to. So there are the services that are being curtailed would be any services where we're able to schedule patients in advance. So some surgery, some kind of testing, some procedures or interventions where we can delay those. So that they would be the ones where we would be postponing specifically. Many of the routine work that we do with patients coming into hospital with acute medical problems, and those things have to continue, and so we can really only make capacity where there's something that we're scheduling that we can slow down. The other big thing is we're sometimes having to impact services because there's a staff member who may have specialized training that we need to deploy someplace else. So, for instance, in the intensive care units right now are probably the area where we need most of our staff. We have nurses who have training in intensive care special skills, sometimes working in other areas, and we are actively redeploying some of those staff back to the intensive care unit. So that could have an impact on some services as well.
Next, we'll move to CTV's Natasha Pace.
Thank you. Dr. Strang, you said that you had hoped to be seeing more progress by this point. We have 91 new cases today. Can you talk a bit about why we aren't seeing lower numbers at this point, or perhaps what more we could do if we don't start to see more improvement?
So I think we certainly are seeing a slow trend downward. It's just not as fast as we'd like to. It's a reality of the new variant, as I've said previously, and I'm not the only one saying this. This is like a totally new pandemic, really, in this third wave. It is highly infectious. Minimal exposure allows for transmission, and so it can also the change of transmission can occur faster. So it's very difficult to control. We've shut down a lot of part of our societies, places where people's social activities, but we still have a lot of people going to work, and it's necessary that they go to work. But every time people get together is a chance for the virus to spread. So we continue to work with making our workplaces as safe as possible, making sure they all have strong protocols in place that starting with people that's why I emphasize today, if people are sick in any way, they cannot go to work, because that may be a sign that you have COVID and you can't spread it to other people. And then all the other protocols around distancing, masking. Often what we're seeing as a challenge is what I call the social aspects of the workplace, lunch rooms, break rooms, where people are forgetting that we still have to be very careful about how we get together socially and keep ourselves distanced wearing masks. So we still have to, with the things we can improve, working with various employers. And before the briefing, I was on a meeting about how we're going to work with a various range of workplaces to do that. But this virus is extremely challenging. Just look around everywhere else. It's a very hard work to bring it under control. We Nova Scotians need to know that what we're doing is working. but it's really hard work. It takes time, and we're going to have to stick with this for a number of weeks to really get this back under control. The other part of this is vaccination. Once we get a much higher rate of vaccine coverage, it then starts to reduce the ability of the virus to spread widely. So the two have to go hand in hand. We got to stick with public health restrictions for a few more weeks and get everybody vaccinated who can.
Go ahead with your follow-up, Natasha.
Thank you. Over the weekend, there were a couple of rallies held in Halifax, and one of those rallies was a car rally involving about 200 vehicles. Organizers say they felt this was a COVID-safe rally because they were in their cars. Looking for some reaction to that. Is that something that would be considered a COVID-safe rally?
So right now, we're not allowing any type of gathering under the public health order. Even people getting together in a group in a parking lot together in cars is technically a gathering, because as we saw, not everybody was in their cars, unfortunately. So we need to keep in very small groups. People have to be within their household groups, or one or two other people socially distanced outside of their household. But we cannot right now have large numbers of people getting together.
Next, we'll move on to Alicia Drouse with Global.
Thank you. I believe this question is for Dr. Carr. I'm just wondering if you can be more specific. You said that protocols are in place to further prevent the spread of the virus within the hospital itself. So what additional steps since last week have been taken to ensure that the virus doesn't spread any further?
Thank you. Essentially, our assumption of there being potential cases, the threat level has gone up. So we've increased just some of the physical kind of measures. If you were to kind of travel into our units, in terms of just there being kind of plexiglass and other things that would limit mobility and spread. We continue to have a lot of diligence in terms of hand washing and our staff wearing their personal protective equipment. We have a team of experts who are continuously reviewing kind of protocols and procedures for how we deal with, how we manage different patient groups. They've added some kind of extra features to many of the patient care protocols, again, in the interest of trying to reduce any possible risk of transmission. So just being extra careful. So those would be largely the kinds of things that are going on. The other thing that we're doing is we're quite actively testing staff members and patients. As I mentioned, we're going to be testing every patient at the Halifax Infirmary and the BG site of the QE2 Health Sciences Center within the next couple of days. We have kind of roaming carts in all of our facilities across the province who are just going from unit to unit and offering testing to our staff members. So again, just very much in keeping with Dr. Strang's message for the rest of the province. We have to, and we are also looking very specifically at how our teams and reminding them that in our break rooms and in common rooms, that we just need to be very careful that we're not breaking down our infection prevention protocols kind of when we are taking those breaks. And so we have teams that are working with our educators to just kind of reinforce those skills and to make sure that we're doing as good a job as we can with that. Thank you.
Go ahead with your follow-up, Alicia.
Thank you. And just as a follow-up, are any of the individuals who contracted the virus within the hospital now in ICU?
Not to my knowledge.
We'll move on to All Nova Scotia's Madeline Bissell.
Thank you. Dr. Strang, I might have misunderstood, so just looking for some clarification. But I thought you said we need 85% vaccinated before loosening restrictions, and the national guidance is 75%. Can you explain the difference there?
So we're working to clarify that. To me, that 75% is the entire population, because you recognize that young people under 11 cannot be vaccinated, and then maybe other people in the population who can't be vaccinated. So our target in Nova Scotia is that we're going to go for 75% of the entire population, which means an 85% coverage rate for those who can get the vaccine. If you focus on just 75% of those who are eligible, that means you're actually down into 60% only of the entire population, which in my mind is not sufficient. So we continue to have discussions at the federal, provincial, territorial level around to clarify what the federal government is meaning. But in my opinion, saying that 75% of those who are eligible is not high enough. We need to get 75% of the entire population should be our minimum standard. We need to go more than that. Ideally, we'd have every single person who can get vaccinated to get vaccine, but our minimum should be 85% of those who are eligible need to get vaccinated.
Go ahead with your follow-up, Madeline.
Thank you. Dr. Carr, can you tell us about the infected staff members? Were they just working in the one unit or moving around the hospital? And were they working at multiple different hospitals or just the infirmary?
I really can't give you any specific information about the staff members. What I can say is that we've had, I believe, a total of 40 staff members that have been positive with COVID since the start of the pandemic. 25 of those cases have resolved. So we have currently 15 active cases across the entire province.
Move on to Keith Gisette with the Canadian Press.
Good afternoon, Dr. Strang. Back to the vaccine. Given what you just said in terms of the rates, with us at around 40% of eligible people, are we on track to hit those targets as of this moment, or do we need to step it up even more?
Well, we've got 40% of our population who have had one or more dose. When we look at it by age breakdown, as I said in my remarks, those 65 and above, over 90% of them who are in that age group have gotten vaccinated. That's phenomenal. And the 65 and 55 plus, or the 60 plus and the 55 plus are over 80%, and they still haven't had as much time to get access to vaccine. So far, the groups that have had lots of time to get vaccinated are exceeding our target of a minimum of 85%. My challenge is, as we open up to the younger age groups, who often maybe not be as don't come out in as many numbers to get vaccinated. My challenge to those younger age groups is to meet that minimum 85 target, because that is the way. If you want to have a more open summer, if you want to socialize, if you want to go to concerts, want to travel, do what you can do to make that happen by getting vaccinated.
Go ahead with your follow-up, Keith.
And this is for the Premier. I guess on the enforcement front, you can't say the weekend was very good, given that there was a court ruling just on Friday. You had a church that, for the second time in 2 weeks, flouted the rules. It seems. Do you feel that people are just looking at it and going, "Well, it's just a fine. I can still do what I want"? And do you need to do something else? Is there something else you can do to try to get people to hear your message?
So we've doubled the fines. I don't see us finding our way out of this. I think enforcement is a part of our solution here. We do need a deterrent. We've had some good days. The previous weekend was better. Obviously, it's disappointing to see repeat offenses, but we need to continue to encourage Nova Scotians. I do think that most Nova Scotians, by and large, believe the restrictions work. And if you see our cases coming down slightly, it's proof that our shutdown is working. So if we continue to work together in that way, the fines are there for a reason. But we need to continue to look out for one another and get vaccinated and follow the restrictions.
Next, we'll go to Radio Canada. Adrian Blanc.
Good afternoon. Could you tell us more about the situation in the East? Are we talking about the situation under control or not? And what is the threshold to consider it a community spread?
So we've had a number of cases of we're not yet certain about how they acquired their infection. So far, throughout the last few weeks, that we've been able to trace through change of transmission, if you will, linking people back to people who were known to have infection. A lot of it goes back to multiple exposures several weeks ago at a hockey arena. But we're starting to see more cases that we can't make that immediate explanation. So I've asked the public health team to do a more in-depth investigation of the cases that are occurring in the Sydney area. I'll be talking with them later this week and looking at what we know about what's happening in that very specific local geographic area of the province and what more we might need to do. But as I said in my remarks, a critical piece is getting people tested, and we're not getting as many people as we need to in the Sydney area to come out and get tested. We have lots of capacity at the testing sites in that part of the province. So if you live in the Sydney area, come out and get tested, whether you have symptoms or not. We need you to do that. We need that for your community, to do your part to help help us understand what's happening in your community and keep your community safe.
Go ahead with your follow-up, Adrian.
And given that the trend downwards is slower than expected, what is the plan for the end of the school year?
So I'm having conversations this week with my colleagues in the Department of Education about are there ways we can at least have some way for get some students back into schools for a portion of time, but no final decisions have been made. But we're having those conversations this week, and we'll bring those back ultimately for the Premier and his for his decisions.
Next, we'll move on to Nabal Snom with the Herald.
Good afternoon. Dr. Strang, can you give us an estimate of how many of the cases we're reporting were asymptomatic?
I don't have that breakdown in front of me. We do look at that. It's part of the challenge has been with the volume of cases where we haven't been able to do all that more detailed analysis, of the epidemiology of our the individual cases. But we're working a way to try to get that more detailed epidemiology this week.
Go ahead with your follow-up, Nabal.
Thank you. It's been about 3 weeks since it was announced that military would be deployed to help us with the COVID response. So can you give us an update on what kind of work they've been doing and how they've been helping us?
Well, they were brought in to help with our testing sites, and Dr. Carr may know this more than I do. I don't know if they're still working in those testing sites. They were sort of short term to help with the surge, but they may still be. Brendan, I don't know if you know that or not.
I don't off the top of my head, sorry.
Next, we'll go to Tim Biscay with the Halifax Examiner.
Hi, sorry about that. Dr. Strang, I just want to follow up on my colleague's question about the schools. If there's some thought of reopening schools, and if vaccinations being opened up to all ages as soon as next week, would it make sense, since schools are highly concentrated, probably the largest groupings of any people allowed now, would it make sense to prioritize vaccination among school-age kids?
So the vaccine, we're going to open up probably within the next, as I said, by next week, we should be opening up for 12 and above. So we're getting there very quickly. So they will become eligible, those who are old enough to be eligible for the vaccinated in the school-age kids.
Go ahead with your follow-up, Tim.
Dr. Carr, on the infirmary, do you have any understanding of what the ventilation system is there, and how is it that staff are getting infected? Were they not offered full vaccination long ago?
The ventilation question really depends upon where you are in the infirmary. There are 2 or 3 different forms of ventilation. There's there's kind of positive pressure, negative pressure, and so we have a number of different formats depending upon where we are. Generally speaking, the acute care units are regular ventilation, and there is less isolation there. Now, that being said, if you look at the kind of the physical changes that we've made to our units and since the start of the pandemic, in many of our units, we've actually created barriers and not so much changing the ventilation, but creating physical barriers between spaces so that we could limit spread. And in terms of our staff, all of our staff have been offered vaccination, and will continue to be a priority for the province. And I would just kind of reiterate Dr. Strang's point, which is the most important thing that we can do as a province is get everybody vaccinated with at least one injection as soon as possible, and then follow that up with all of our priority areas to get a second vaccine, which is the path that we're on. And so we are very much in support of that.
Next, we'll go to Victoria Walton with the Coast.
Thanks. I'm following up on my colleague's question there about younger people getting their doses, school-aged children. I'm wondering that group of 12 to, say, 18-year-olds who are still youth, will they need their parents' permission to get vaccines? And in terms of, I guess, just capacity of vaccination sites, will those youth be able to have their parents, a guardian, accompany them in to get their vaccines? How will that look once children start being vaccinated?
So we don't actually require for even our routine grade 7 vaccinations. They don't actually have to have parental consent. It's on the judgment of the immunizer whether the youth is determined to be able to make their own decision around vaccine, and that will carry through for COVID vaccination as well. Certainly, we'll be accommodating the need for some youth to be accompanied by parents as necessary through our vaccination clinics.
Go ahead with your follow-up, Victoria.
Thanks. And this question is for Dr. Carr. I'm wondering, in terms of ICU capacity, are you concerned we're going to run out of beds with cases still going up if we're seeing daily cases around the range of 100 as we are now, and about 1, 2, 3 of those people might end up in the ICU? Are we worried that patients are going to need to stay in the ICU and will have more capacity than we'll handle, or do you think that recoveries will counteract that?
Thank you. It's a very important question, and it's something that we are watching literally minute by minute. What I can say is that given our current trajectory and the current modeling of cases, if we continue to manage, to work collectively, to do everything that Dr. Strang, the Premier, have outlined, if we can keep our case numbers going down, we expect to be able to manage what will be a continued surge in acute inpatients, and some of those patients getting sick enough and needing to go to the ICU. We feel that we have adequate capacity for our current trajectory, and so all of our effort is to make sure that we've got our staff positioned so that we can manage cases, and we have that capacity, in regional hospitals right across the province. And so we feel very good about the capacity that we have, and in particular, the teams that we have working in our ICUs. And if we take our foot off the gas and allow, this to get out of hand, we could as we've seen in many other jurisdictions, we could very easily be in a situation where where we reach or exceed the limits of our capacity. And we just don't want that to happen.
Next, we'll go to Jean Laroche with CBC.
Good afternoon. I hope this question dovetails nicely with what Victoria just asked. And my question is for Dr. Carr. Can you talk a little bit about, you talked about this capacity. How does 21 people in ICU kind of compare to a normal busy time? And what is it specifically about these patients that the care they need or the care they need that makes them a particular challenge, and the fact that you're having to redeploy resources?
Thank you, Jean. It's a great question. So our total capacity for ICU is around 119 or 120 conventional spaces across the province. Our ICUs are continuing to look after many other patients who have necessary surgeries or have had other serious illnesses that require intensive care. So the addition of 20, really, our modeling suggests that we could probably go up close to 60 COVID patients and be able to work within the limits of our capacity. And our staff it is intensive work. Patients who are ill with COVID they're like all ICU patients, they're extremely ill. They do have high care requirements for respiratory therapists, for nurses, for physicians. They require, kind of hourly, continuous monitoring and hourly adjustments to therapies such as oxygen therapies and other things. They require, oftentimes, they do better when their positioning is changed. You may have heard the term proning, where patients will be actually turned over and put kind of face down. And that's essentially just because it's easier for them to breathe that way. They usually feel more comfortable. And if you could imagine a patient who has multiple lines, like multiple intravenous's and other lines, breathing tubes, many other, other devices, the technical challenge of actually literally turning that patient over in a bed requires a substantial team of staff. And so we're constructing these kinds of teams in all of our ICUs and those teams will oftentimes spend the better part of the day going from patient to patient to patient, just adjusting their positioning, which is a substantial kind of resource requirement.
Go ahead with your follow-up, Sean.
And this one's for the Premier and perhaps Dr. Strang. A news release went out just moments ago from your office, Premier, talked about a meeting you had with New England governors about perhaps receiving some of their excess vaccines. Can you talk a little bit about how much we're talking about in terms of vaccines coming from the New England states? And what would that, if anything, do to the timeline that Dr. Strang has set out in terms of the vaccine schedule?
Thanks for that, John. So we don't have any specifics. This came out of a discussion at the meeting that we had, which I co-chaired with Governor Lamont from Connecticut, and we talked about how they're at 70% plus for first dose, and our provinces collectively are all around the same, around 40%. So they have excess, and obviously we'd like to see more vaccine flowing in, but it is a federal decision point both here and in their country. So we decided as co-chairs to send a letter to our respective federal governments to continue to pressure for more, given that our volumes have fluctuated throughout our scheduling of our vaccine program. We're still on track for first dose, and in our province you book your second dose at the same time. So we're not off track, but obviously we could use more to push that timeline further.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you. I do remain cautiously optimistic of where we are, seeing that we have cases in the double digits 2 out of the last 3 days, and our testing and our restrictions and protocols remain a key part of how we're going to continue to confront this third wave. But our key out of this third wave really is our vaccines. We need to continue to roll that out, and people need to book their appointments. So today we dropped to 30 and up. I expect if all goes well later in the week, we'll be able to do more with 20-something and up. And then next week, as we talked about, we can drop the age to all those eligible so that we're able to book our vaccines. So young people, I expect, hopefully will come out in the large numbers we see as percentages. 97% of those 75 to 79 have had their first shot. Dr. Strang referenced over 90% of those in their 60s have their first shot. More than 70% of those over 55 have their first shot and counting. People continue to book as you get lower into the age groups. These percentages matter. The more people we get vaccinated, the better our chances are of protection. So everyone who is eligible, please book your first dose. I love seeing the pictures of people proudly displaying their arms with that noticeable Band-Aid. For many of you, it's like a badge of honor. So go to get your shot and take a picture. You're doing your part to protect yourself and those around you. That's something to be proud of and always to remember. So continue to do those things. Follow the restrictions and go out and get vaccinated. Together, if we can do both of those things, we can crush this wave.